Welcome. Thank you for signing up for our chronic disease webinar. I'm Dr. Isabel Sharkar, co-founder of Indigo Health Clinic in Washington, D.C. And for over 15 years, we've been helping people solve complex chronic health issues. Now, if you're looking for real answers, you're in the right place. While we're gearing up for the main event, I've put together a quick 2-part mini training to help you start thinking about your health journey and what's next for you. Here's the truth. This isn't just another webinar. This is about giving you clarity, because if you're here, chances are you've been searching for answers that no one's been able to give you up until now. So let's talk about the big picture. Did you know that over 129 million Americans are living with at least one chronic illness right now? That's half of all adults. And what's even more startling is that nearly 42% of them are juggling 2 or more diagnoses. For women, the burden is even greater. Nearly 4 out of 10 women are managing at least one chronic condition, which is a much higher rate than men. And for those of us balancing careers, families, and our own health, the pressure is relentless. So this isn't just a statistic, this is a wake-up call. But how did we get here? Chronic illness doesn't just happen. It's the result of the perfect storm: lifestyle, diet, genetics, environmental exposures, and yes, even how our healthcare system operates. So here are 3 key reasons why so many women like you are feeling stuck and they don't feel in the driver's seat of their health journey. Number 1, the challenges of conventional medicine are many. Let's be honest, conventional medicine isn't built for complex chronic illness. And that's where so many women are falling through the cracks. There's also too little time. Most appointments are 15 minutes or less? That's not enough time to describe your symptoms to someone, let alone get to the root of them. And then we've been prioritizing symptom management over root causes. Doctors are trained to look for a pill for every ill, further masking symptoms and medication rather than really uncovering what's going on at the root. And lastly, we have missed diagnoses. Chronic conditions like Lyme disease, mold toxicity, or heavy metal exposure often mimic other issues and go completely overlooked. So you've likely heard phrases like your labs look fine or it's just stress. But deep down, you know something's not right. The second reason why so many women feel stuck is because of the slow pace of change in medicine. I mean, here's a frustrating reality. It takes an average of 20 years for new research to make its way into standard medical practice. For patients, that means that solutions exist, but then they're stuck on the sidelines while you're left waiting. And at Indigo Health Clinic, we do not wait. We actively seek out therapies that are safe and effective and backed by research, because we believe you shouldn't have to wait decades to feel better. And the third reason is the problem of misdiagnoses. Here's the kicker. Many chronic illnesses mimic other conditions, which lead to misdiagnoses and years of frustration. For example, Lyme disease might be mistaken for fibromyalgia, rheumatoid arthritis, or multiple sclerosis. Mold toxicity can look like anxiety and depression, autoimmune disorders, and even chronic fatigue. And early Alzheimer's is often overlooked and misdiagnosed as part of aging, leaving women stuck in a relentless revolving door, seeing specialists doing all the tests under the sun and still no answers. So it's time for a new approach called root cause medicine. Because here's the good news. Those 3 reasons keeping women stuck, they no longer have to. And at Indigo Health Clinic, we do things differently. We practice integrative medicine, which combines the best of conventional care, holistic therapies, and lifestyle changes so that we're addressing the root causes of your symptoms. What makes us different? We see the whole picture. No more fragmented care. We connect the dots between your symptoms to understand what's really going on. We also take time to listen. Our visits are about 2 hours long, so you can share your full story and feel truly heard. And you're in control. This is collaboration. We're here to guide you, but you're ultimately in the driver's seat. So if you're tired of feeling stuck, like no one truly gets it, this is your chance to try a new approach, to really get to the bottom of what's going on and finally create a clear, actionable plan for your healing. So here are 3 easy steps to do next. Number 1, click on the link below and book your clarity call with me. This is a great opportunity for us to discuss your story. I'll answer all of your questions and we'll figure out the best next steps for you. Number 2, watch the next mini training video coming to your inbox tomorrow. And number 3, mark your calendars for our webinar. This is where we're going to dive even deeper into topics like root cause medicine and also the hidden factors that are driving chronic illness. You really don't want to miss this. I'll see you there.